Hello everyone. Since we are learning about first aid, there are few basics equipments. This may be a handmade equipments or whatever resources are available. You have to make use of it to stabilize the victim or sometimes to stabilize the part which is injured or fractured. One of such equipment is splint, and we are going to learn about how to make splint. So, splint is a piece of medical equipment used to keep an injured body part from moving or to protect it from any further damage. So, you stabilize that injured body part, so further movement will not damage it further. Splinting is often used to stabilize the broken bone, usually used for the fracture and all. It can also be used if you have a severe strain or sprain. If you sprain an ankle or any other joint, you can make it stabilize by using a splint. Placed properly, a rigid splint will help ease the pain of the injury. This will not only stabilize the joint, but it will also reduce the pain, which usually occurs with the movement of the limb. And if you or a loved one is injured at home or during an activity such as hiking, you can create a temporary splint from any material which is available around you. These are the different types of splint made up of wood or any other material. So, various material which can be used, which is available around you in the surrounding. A rolled up newspaper, many newspaper rolled up and made a rigid splint can be used as a splint, and a heavy stick, a board or a plank or a rolled up towel also can be used as a splint. What you will need for splinting an injury? If you are using something with sharp edges or something that might cause splinters such as stick or board, be sure to pad it well or by wrapping with the cloth. So, if your splint has got sharp edges, you wrap it with a cloth and make it padded. You will also need something to fasten the homemade splint in the place. So, by putting a splint, you have to fasten with the limb. So, you will need something like a belt or a bandage or a rope to fix the splint with the limb. Try not to place commercial tape such as duct tape, sometimes that adhesive tape used for in electricity fixation and all such thing, which might be having some chemicals which is harmful to the skin of the person. So, try to fix it with a rope or a cloth or a bandage, something like that. How to apply a splint? You can follow the instruction below to learn how to apply a splint. First of all, attend to any bleeding. Usually sometimes with a fracture, particularly compound fracture, where the bone is exposed through the skin, one might find bleeding. So, attend to bleeding if any before you attempt to place the splint. You can stop the bleeding by putting pressure on the bleeding site, and this pressure you should see the watch and apply the pressure for 5 to 7 minutes, that can stop the minor bleeding. Then apply padding, then apply a bandage or a square of gauze or a piece of cloth on the wound, and do not try to move the body part that needs to be splinted. Do not try the fractured part or a sprained part of the body, which will worsen the thing. So, try to move it as little as possible. By trying to realign a misshapen body part or broken bone, you may accidentally cause more damage. Place the splint. Carefully place the homemade splint so that it rests on the joint above the injury and joint below the injury. Suppose your injury is somewhere mid arm, then you have to cover wrist and you have to cover elbow as well. So, joint above the injury and joint below the injury, then you apply the splint. See in this, if fracture is somewhere here, this joint is included and the joint above is also included up to the elbow. So, carefully place the homemade splint so that it rests on the joint above the injury and joint below it. This we already explained. Avoid placing tie directly over injured part. So, when you tie it up, the tie should not come directly on the injured part. You should fasten the splint tightly enough to hold the body part still. So, when you fasten the splint, it should not be too tight that it will obstruct the circulation of the blood. It should not be too loose that it does not serve the purpose. So, after applying the splint, check for the circulation by pressing the nails or seeing the nail fingers whether it is pink. By pressing it becomes white, when you release the pressure it becomes pink, means circulation is normal in that limb. These are the various splint one can use for the hand. This hand, whole of the hand is tied up with the chest wall, splint for the fingers, splint for the ankle joint, for the wrist joint and for the hand. Once splinting is completed, you should check the area around it every few minutes for sign of blood circulation. So, after putting the splint, you keep observing the patient. If the extremities begin to appear pale or swollen, means your bandage is too tight, loosen it. Post accident swelling can make the splint too tight. So, after few hours or few minutes, like after half an hour, the swelling may increase and that will tighten your splint. So, in this case you keep on observing, if you feel the circulation is affected, again loosen the splint. If the injured person complains that splint is causing pain, then it is too tight. In this situation also you loosen the splint wrap on the splint. If these measures do not help, the person is still feeling pain from the splint, you should remove it. After applying splint, if pain is worsening, patient feels too tight, if circulation is affected, you remove the splint. After you have applied the splint, the injured body part is no longer able to move, then you can call for the help on 112. This is not our, here we call 112 in our Indian scenario. You can also take your loved one to the nearest urgent care clinic or emergency room. You will need to receive checkup and further treatment. Splinting of hand. So, first and foremost, again remember, control any bleeding. First treat any open wound, like there is a wound, so clean the wound, do the dressing with antiseptic solution or antibiotic ointment and control bleeding. Place an object in the palm of the hand, then place a wad of cloth in the palm of the injured person's hand and a washcloth, a ball of socks or a tennis ball can work well. Ask the person to close the finger loosely around the object. And then you apply padding like this. After the person's fingers are closed around the object, loosely place padding between the fingers and then you apply the splint. Next, use a large piece of cloth or gauze to wrap the whole hand from fingertips up to the wrist. Here padding are put between the fingers, to keep them separate. And then you secure the padding with the cloth or tape like this. This is the elastocrep bandage and make sure to leave the fingertips uncovered. See to it that fingertips are not covered inside the splint or inside the bandage. So, you can check the circulation on the nails, by pressing the nail you can check circulation intermittently. Or you can see nails becoming blue when the circulation almost stops. After the splinting is over, you seek the medical help or take the victim to a nearest hospital setup or a emergency room. These are the finger splint flexible bands. These are also available and you can in this flexible band you can put the wrist or a arm or something like that. This type of bands are available and it has to be fixed up with a bandage or a wrap or a cloth. Splinting the leg, again this knee joint is splinted where this flexible band are kept from knee joint few inches above and few inches below, and then it is fixed up with a bandage or a elastocrep bandage. When to contact medical professional? You should seek immediate medical help should any of the following condition occurs. Just remember, you are trained volunteer in first aid and you are not a medical expert. So, in many situations you have to depend on medical expert for their advice. So, these are the condition when immediately you should call doctor or a team of healthcare professional. When bone is protruding through the skin, an open wound at the injured site, at the suppose fracture is here, but along with that there is a wound also, open up wound which requires stitching or a proper cleaning. Loss of pulse at the injured site. So, suppose this victim has injured here, but his pulse on the leg, on the foot is not palpable, pulse is not absent, then this is an emergency where you need medical help. Loss of sensation in the injured limb, patient is not able to feel any sensation. Fingers or toes that have turned blue and lost sensation, this because of this injury the whole foot has become blue or there is a loss of sensation, and feeling of warmth around the injured site. Then these are the condition in this, you do not interfere in this matter and just wait for medical professional to come. When faced with an emergency injury, your first action should be arranging proper medical attention for the injured person. As soon as you come to know there is somebody injured, first of all you tell somebody to contact a medical emergency ward or a emergency team or a medical professional. While waiting for the professional to arrive and or to assist with the transportation, a homemade splint can be effective first aid. After that you try to help the victim by make him comfortable, put his injured limb in a splint, try to stop the bleeding, try to do dressing of cut and wound if possible. But you must however carefully follow instructions so that your splinting does not make injury worse. So, after splinting you must remember there is proper circulation of the blood, there is no increase in pain, there is no increase in swelling which is causing the splint too tight or under the pressure, and there is no loss of sensation in that limb. All such things you have to check and then only carry on with your splint and wait for the medical doctor to come and take away the patient. These are the references for this presentation. So, making a splint is a very simple and very effective method to treat a injured limb, but one should be very sure that whatever you are doing is going to help the victim and not worsen the injury. So, by splinting a limb, you can help a patient by reducing the further damage, by reducing his pain, and you can make patient comfortable till medical help arrives. Thank you very much.